Hello, my name is Jennifer Labus, and I'm going to be doing a newborn assessment. First, what you start off with is the vital signs. So I'm just going to listen to the lungs real quick. You want to notice if there's any crackles or wheezes. This baby has clear lung sounds. And then you want to take the pulse for a full minute. Right on 120. You want to listen to the respirations as well. And then you want to look at the head, check the fontanelles. You want to see if there's any bulging or any swelling, or if there's any, if they're depressed in or sunken in, that could be a sign of dehydration. And then you want to look at the sutures to make sure that they're not overlapping. And also you want to notice if there's a caput on the back of the head, which is just a little bit of swelling of the head and a little bit of fluid, and that's from the baby going through the birthing canal. And also you want to check for hematoma in the head, and notice the shape of the head. Sometimes the head can be a little bit cone-shaped from if they were a vaginal birth. If they're a C-section, they may have less of a cone head. Then you'll want to look at the eyes. You want to make sure that the eyes are reactive. And then you'll also check the red reflex. And what that is you turn the lights off and shine the light in the eye and make sure that you see that red light. You also want to make sure that the eyes are symmetrical. One's not higher or lower than the other one. You'll want to look at the sclera to look for any yellow color, which could be a sign of jaundice. You want to make sure that there's no drainage, and that they're blinking simultaneously and not one of the other. Then also you can look at the skin and the sclera for jaundice, and a good way to check for it is to put your finger on the bony prominence of the forehead, the nose, the chin, and the chest. Hopefully there's no sign of jaundice down to the chest, but if there is, then you could also check the knees and the lower feet. You'll also want to examine the baby for any bruises and note any of that. Acrocyanosis is a little bluish color of the palms, the feet, and the extremities. This is usually because the blood is focused on the trunk for the organs and just hasn't gone out to the limbs. This should go back to normal within a few hours of birth. You'll want to look for note if there's a harlequin sign, which half the baby will be the normal color, and then the other half of the face could be a darker red or a darker pink color. You'll also want to notice, look at the ears, look at the shape, make sure the ears are symmetrical, look for any tags on the ears or any drainage from the ears, and you'll also want to note where the ears are in position to its eyes. You want to make sure that the ears are level with the eyes. You can just draw a line with your finger across the head, make sure that they're level. And Then for the nose, what you want to do is just check its nares, look for any nasal flaring, and you'll want to check the patency of the nose. So what you're going to do is you can put your finger in the baby's mouth, and when you do that, it should start sucking. And then you'll cover one nostril, make sure it's breathing out of the other nostril, and then do it again on the other side. And while your finger is in here, you can check the mouth. You can look for, check the palate, see how it feels, whether it's smooth or rigid. You'll want to look for Epstein pearls in the mouth, which are little whitish or yellowish cysts. You want to make sure that it's pink and moist, and also look at the lips, make sure that they're not cracked or anything. And also look for ankylosing, how do you say that? And then you move down to the neck and look at the skin folds of the neck. You want to make sure that the neck is always clean and dry. Sometimes breast milk gets stuck in the folds of the neck, and they can produce an infection that way. So you want to make sure it's clean and dry at the neck. And then, excuse me. And then you'll check the brachial pulse. So you'll put one of those sleeves on this thing here. You'll just check on the inside of the arm and take its temperature that way. And again, check the arms for any bluish color. You want to make sure that the arms move simultaneously and that they move okay, and that they're symmetrical. You want to check the digits, make sure they have all 10 fingers. Sometimes they will have an extra finger spur on the side of their hand or their foot. Then what you can do next is you look at the shape of the chest. Note if there's any indentation of the chest or pigeon chest. You want to measure the circumference of the chest, and note that compared to the circumference of the head. You'll want to listen to the apical pulse, and again, listen to that and feel that for a full minute. Then you also want to check the breast buds. The breast buds might be a little bit enlarged from the estrogen from the mother. And you'll want to look at the nipples and note if there's any drainage or discharge. Then also check the capillary refill, should be less than 3 seconds. So that's always good. For the apical pulse, you'll find it, pause. Okay. For the apical pulse, you'll find it in the 4th and 5th intercostal, and you'll want to check for any murmurs, extra clicks or sounds. I already listened to the lungs and noted that they were clear, and listened for any cracks or wheezes, crackles or wheezes. For the abdomen, check the size and shape of the abdomen. Note any swelling. You want to listen to the bowel sounds. Listen if they're hypoactive or hyperactive. Okay, and those sound pretty good. You'll want to look at the umbilical cord, make sure there's no hernias or any drainage or discoloration. You'll want to make sure that it's clean and intact. You want to make sure that it's clamped and cleaned. Depending on the doctor, they might have you clean with alcohol, they might have you clean with soap and water, and some people actually use breast milk to clean it. So it just depends on the doctor and the mother. You'll want to make sure that it stays dry and there's no signs or symptoms of infection, such as any green or yellow discharge, because that's never good. For the groin, I want to check the femoral pulses inside of the leg, so you want to be able to feel those. And then for female, and for male, you'll inspect the groin. For a female, you might be a little swollen. Also, there might be a little bloody discharge from the mother of just excess hormones of being the mom. Also, you might see some uric acid crystals, which can be yellow crystal looking things, and if that is present, that might be a sign that the kidneys are not functioning very well. In a male patient, you'll want to make sure that the testes are distended. You'll want to palpate those. If they retract, you'll want to put pressure up here and then palpate the testicles. You'll want to check the rectum, make sure that the rectum is patent, make sure that the baby's having a bowel movement or not, and document that. And then you'll also want to look at the male and see if he's circumcised or not. Sometimes a doctor may use a plastibell, which is a belt-shaped plastic cone thing that goes over the penis. You do not want to use lubrication or Vaseline, because it might make the plastibell come totally off. For a gom comb, you would want to use Vaseline for that to prevent the skin from sticking or anything. You want to make sure that they're voiding correctly and a good amount, have a good output, and that there's no any bleeding or anything in the urine. For the hips, most nurses don't check this. It's usually the physician or the pediatrician, but they just check the hips and the rotation, range of movements, make sure there's no clicking with the joints or anything. For the skin, you'll want to assess the whole body, make sure that it's dry and intact. There may be some flaking of the skin. That's normal after birth. Mongolian spots. Mongolian spots will usually be on the back. It could be on the buttocks area. This infant actually has a small Mongolian right here, but it's more normal in the darker skinned races and not Caucasians. Lanugo is fine hair along the body. A lot of infants are born with it, and it falls off after a couple days. Then birthmarks, there's a couple different birthmarks. They can have a stork bite, which is like a V shape on the forehead. You can also have it on the back of the neck. There's also the port wine birthmark, which is just a very dark red color, but it's smooth. There's no raising or anything of it. There's also a strawberry hemangioma, and that's a dark red color as well, but it's more raised or swollen looking. You'll want to check the neuros, make sure that the baby has a good strong cry. You'll want to make sure that the baby can suck when you put your finger. That's a very good sign as well. And for the rooting, you'll just take the tip of your finger from the edge of the mouth across the cheek, and wherever you go this way, the baby should turn towards your finger. Go this way, the baby should turn towards that. And that's a natural reflex. The palmar grasp, when you put your finger here, the baby should automatically grasp your finger. Same thing with the foot, should have a little bit of reaction as well. For the Moro, that's just a test where you'll take the baby and you'll drop it just a little bit carefully, and you'll want to get a reaction. Another way is to lift the infant up and then just quickly drop it a little bit, and again, you'll want a reaction. If there's not a reaction, there may be some neurological deficiencies. For the Babinski test, you'll want to draw an upside down J on the bottom of the foot from the heel to the pinky, and the toes should clench. You'll want to check the spine. Look at the baby's spine, make sure there's no bumps, make sure it's aligned correctly. You'll also want to check the lower back for any indentation. If there is a sacral dimple, it could be a possible sign of spina bifida. You'll also want to note if there's on the skin any milia, which is little white spots on the face. Those are normal for babies as well. and also, what is it called? The arrhythmia toxicum. Those are little red spots. And so you'll just want to document that as well if the baby has some. And this is how you do a newborn assessment.
Top of the foot.
Yeah.
Okay. Perfect.
Check.
You guys are awesome. Murmurs are okay, but unless the baby has cardiac issues or has a risk, right?
Right.
You got, you got nipples and drainage.
Yes. Okay. Platelet, Epstein, that.
I think you missed the femoral pulses.
The femoral?
Pulses.
Oh, I said you want to feel on both legs.
Oh, okay, both legs.
Yeah.
Good, good. Okay. I'm glad we're doing this together.
Yeah.
Oh, shit.
Hey, man, what's up? How long I needed still? I still haven't packed or gone to visit my mom.
Do you want to do the bath later?
Okay, sounds good. Thanks. Bye. No, I have 3. I have until 3.
Oh, who was that? Is that Taylor?
Oh, awesome. Okay, sweet. No, Nicole said the single room is a lot cheaper than the double, and that is with a discount, and they don't have roll-away beds. Roll-away beds.
Really?
Yeah, so, no, I don't have a sleeping bed, but we can get an air match. Tris. I can't talk.
So is this then all we have to do for, like, our grading part? Or how do we...
For what?
Do you know? How, well, the grading portion of it, is it just that? We just get it
I guess this is...
Okay.
I'm just marking everything that I know she did. And I'm guessing she's going to match this up to our videos. Did you check for cleft lip?
No, I didn't count that
Okay,
off.
okay.
Shit. How do you check for cleft lip?
You're going to see it.
You'll just see it, so
Yeah.
just voice it?
Yeah.
Okay.
Just tell, like, when you're working on your mouth. Because you already have your finger in their mouth to check for
the
nose
sucking.
patency and for sucking and
Okay.
rooting. And say when you're in here, you can also check the palate. You want to make sure everything is pink and moist. You can check the ankylosing and the Epstein pearls. And then when you're looking, you want to make sure that there's no cleft lip.
Okay.
Yes.
Let's do this. Let's get the shenanigans over with.
So I put a check on everything that you got, and then I just put missed if you missed it.
Do this
That's
and
good.
Go home and eat food before I go to work.
You got that, you got
Alright.
that, you got that.
I hope my computer doesn't die. I wonder how much charge this has. It looks
This
low.
is what we can do, Kaylee, is...
Oh, got 2 hours left.
You
We're
were
good.
here.
God, we got us both done in the hour that we had set aside for one.
Hey.
Hey.
Poor Nancy came in, and
Yeah, she was supposed to have a class in here.
she was supposed to have a class in there, but they kicked her out. She was supposed to have a class here, but
And we kicked her out.
we kicked her out.
We told her we'd leave, and
Yeah,
she's like,
I'm
no,
like, I
you
can
guys
do
were
it a
here.
different day.
I would have been